Really, the products are quite similar. Um, Even the clinical trial results are generally similar. I mean, one of the things with the Pfizer product, though, is that you had to do an antibody test, um, basically checking for an antibody against the vector. And if you tested positive, then for the Pfizer product, you were ineligible to get it. For Hemgenics, there's an antibody test as well, but if you test positive, you can still get the medication. And part of it depends on what the level is, but most patients with relatively low level antibodies could still get infused. So I think Pfizer saw a relatively small population of hemophilia B patients who are eligible. For them, some would be absolutely ineligible because of this antibody test. Hemgenics had already sort of established this place, um, you know, in the marketplace, and I think they just saw that, in addition to, there's been sort of a slow level of enthusiasm among patients and physicians, although I think that that's changing now. And so I guess they just decided that there wasn't really enough room right now for, two hemophilia B gene therapies that are otherwise quite similar. So, um, I mean, it's fine. It in some ways makes things easier for us because, to be fair, we would have onboarded the Pfizer gene therapy as well, to be fair to the patients and the drug companies, make sure we could offer patients everything. That's our philosophy, is we're not gonna pick and choose. If something's FDA approved, we will, get it available and offer it to patients. So that's why in that respect, it kind of makes things easier. I don't have to set up a contract to procure, that drug, Beq-Vez. I don't have to, teach my staff about the differences between Beq-Vez and Hemgenics. And so, like I said, in some respects, it's made things a little bit less complicated and easier when we're talking to patients or my staff. So I mean, it would have been fine to have it, but I'm personally not entirely disappointed that it's not there. Just like I said, it just makes things easier and less complicated. Again, the Pfizer product Beq-Vez was very, very similar to Hemgenics. So it was really going up against something that was already established and wasn't offering anything different. The products that are currently in clinical trials that have just started. So Regeneron is an integrating gene editing hemophilia B gene therapy. And one of the advantages of this one is that, at least in theory, it should be able to be used in younger patients. I mean, Hemgenics is 18 and older. There, I believe, is a trial looking into like somewhat older teenagers, so 16 to 18 or something like that. But I think ultimately whether this could work in younger children, 2-year-olds, 4-year-olds, 6-year-olds, is highly, highly questionable. Whereas the Regeneron gene editing, just because of the fact that it is integrating, meaning it's edited directly into the chromosomal DNA, that should work even in young children. And their protocol does have a plan to get down to very young children. Now, of course, it's going to start with adults, and that'll have to pass all the safety and everything. So it's not like we're dosing a 2-year-old with this product next year or in 2 years, or maybe even not for 5 years. But eventually, it's going to get down to children. So I think that's one difference. The other difference being integrating is that the plan or the theory is that this product should be able to get all patients or most patients into the normal range. Whereas with Hemgenics, most patients actually don't end up in the normal factor 9 range. They end up in a range that is obviously very protective and helpful and prevents bleeding, but not a normal factor 9 level. So I think that the Regeneron product is aiming for, 1, getting normal levels, and 2, being able to dose all ages. And then the B-Bio product is an altogether different type of approach, which is a cellular gene therapy approach, which is intended to be redosable and titratable. So the current gene therapies Hemgenics is one and done. If it works, great. If it doesn't work, sorry, you can't get it again. And you can't get any other similar gene therapy again. Whereas with B-Bio being a cellular therapy, the idea behind that is we're going to harvest these cells, we're going to put the factor 9 gene in them, and then we're going to infuse them into the patient, and those cells will produce factor 9. These happen to be blood cells. And that, if your level is too low, oh, that's fine. We have more cells. We'll just put more in there. We can just titrate the dose up. So I think that obviously there's clearly other companies looking at innovative approaches to overcome some of the limitations we have with Hemgenics. It's not redosable, so if you don't get a good response, too bad. The B-Bio product would be redosable. Hemgenix likely wouldn't work in younger children. The gene editing product could work in younger children and could get to normal ranges. So I don't think that Hemgenix's approval is stymied competition to overcome some of the limitations of that specific product. I think that the field is ready. We're seeing more and more patients receiving this. And, as is typical of things that are really innovative and new, it's, there's this, sort of initial excitement. And then there's this period of disillusionment, like, oh, no, it's not really going to work. I don't think it's really that good. And then some changes may be made or some differences. And then all of a sudden, then it takes off. I mean, I think of AI like that. Like right now, it's like, okay, we're super excited, and then, oh my God, no, we're a little bit scared. But there's no question that AI is going to, impact every aspect of our life going forward, and it's just a matter of figuring out how to do that. And I think with gene therapy, there was all this excitement, and then it kind of was, oh, these aren't that great, and it's kind of died off. But I think we're at that point where the tide is going to turn, and people are going to realize that that Hemgenix in particular is a really, really good product, and that the future products will be either different or better or offer things that Hemgenix cannot offer, like I said, like redosing and younger patients. And so, no, I think that hemophilia patients are excited about and are ready for products that can provide them the potential for getting cured.